Since the 1970s, corporate America has become increasingly interested in the health and wellness of employees, and for good reason. Both theory and research support the idea that healthy, well-balanced employees are more productive, more content with their jobs, and cost their employers less in healthcare expenses than companies which do not incorporate wellness into their workplace climate. An effective wellness program should take into account the needs of all employees, from the CEO to the maintenance staff, to ensure the program is appropriate and available to everyone. A successful wellness program will also involve employees in the development process. By assessing the needs and interests of employees through surveys and polls, companies can create a targeted and successful program that meets the needs of all its employees. For many companies, one of the most effective ways to develop a healthy workforce is to provide tobacco cessation resources to its employees. More than 40 years after the U.S. Surgeon General described the dangers of tobacco use, over 20% of America's population is still struggling to kick the habit. Since tobacco use is an increasingly costly addiction with well-documented data supporting the negative health effects associated with it, the impact on an individual is both overwhelming and deeply troubling. Worksite-related issues caused by tobacco use is well established. On average, tobacco users take twice as many sick days as non-tobacco users. Additionally, consider the fact that the average smoker takes 4 10-minute breaks each day to smoke. This, combined with the increased sick leave, translates to working a full month less each year than non-tobacco users. This loss in productivity, combined with facility maintenance, smoking-related accidents, and secondhand smoke-related illness, all result into lost revenue. Altogether, the average company will spend about $3,400 more each year to employ tobacco users than non-tobacco users. Of course, tobacco use affects more than just the bottom line. Studies show that company image is affected by tobacco use from both employees and external institutions. A company which provides cessation resources to tobacco users and promotes wellness in general sends a message that it values its employees. Such an effect is also said to increase morale and company loyalty. Throughout Northeast Florida, the Quit Smoking Now program is available to assist companies that want to address tobacco use at the workplace. Created by the Florida AHEC Network, the Quit Smoking Now program is a 6-week group cessation program designed to tackle the physical, psychological, and social barriers to quitting tobacco use.
My name's Jeff Hurst. I've been smoke-free now for 8 months. February 2nd was my quit date. Having the quit smoking cessation class at the work site was perfect for me in terms of not having to leave the work site. I used my lunch hour. We did it every week on Wednesdays for an hour a day for that period. I've tried everything. I've done the patches. I've even had shots in my face long time ago. I've done the pills. Nothing worked. What really worked this time was the camaraderie. And plus, you don't want to be seen as someone that's given up, so you have the support group that will help you through.
My name's Kathy Tripp, and I've been tobacco-free for 15 months. Oh, the group support was awesome. There was everybody in there, even when people were having difficulties and backsliding and anger issues that they would be going through. Everyone was so supportive.
Key topics addressed throughout the program include selecting a quit date, coping with withdrawal, identifying smoking triggers, nicotine replacement therapies, and relapse prevention. Led by a trained tobacco cessation facilitator, the Quit Smoking Now program offers participants a chance to develop a game plan for their cessation process in a supportive environment. The facilitator provides guidance, additional resources, and support both during the program and between sessions. But the hallmark of this program is the group dynamics. Working together with the goal, participants help each other through the cessation process, offering support and motivation throughout the program.
My name is Tanya Hill, and my position is Employee Wellness Coordinator for the Duval County School Board. Definitely. What I do is basically try to keep our employees healthy. I do that by coordinating educational seminars about weight loss, nutrition, fitness, things of that nature. I have definitely noticed a change in the employees that have gone through the program, especially those who are coupling that with weight loss. They found that quit smoking has helped them with weight loss. I found that a lot of them have talked about increase in energy and just overall happy. So the morale has certainly increased with those people.
As with all wellness programs, having the Quit Smoking Now program available at the worksite will decrease the number of barriers a tobacco user typically has to face when attending a program.
Having the program at work actually made me more willing to go because it was at work. It was easier to get there. I knew the area. It wasn't like I had to go to a place where I didn't know anybody. Whereas at work, now I didn't know the people, but we all shared the same environment. So that was one thing. It really made it a lot easier that way.
Additionally, the camaraderie and support of the group often carries into the general work environment, which increases the support and often the success of each individual in their efforts to quit.
I really enjoyed being with my coworkers. As a matter of fact, I got 3 people to join. 2 of them quit because of my insistence to join. But it was good. It was really good.
Of course, for many companies, an on-site program may not be the best option, but companies can still help their employees by referring them to one of the many community-based Quit Smoking Now programs. Phone counseling is also available through the Florida Quit Line, a partner of the Florida AHEC network. The first thing any company should do when implementing a new program is to obtain the following information. How many tobacco users do you have on staff? Have a large number indicated that tobacco use is a problem? Have those employees requested additional resources related to tobacco use? Answering these questions is essential to determine the best resources for your employees. Additionally, make sure you have the support of upper-level management. Employees will feel more compelled to take the first steps towards healthier behavior if it is believed that their superiors support their decisions. Finally, call Northeast Florida AHEC for more information on the Quit Smoking Now program. AHEC will be happy to discuss your options and provide you with additional resources to offer your employees.
But I would recommend every business, especially the fact that it's free. It doesn't cost the business anything.
I would definitely encourage all businesses who take on this program to open it up to not only their employees, but their families, their spouses, because they will need a support system at home. They would need encouragement outside of the school, outside of the work area. And so that's a good benefit, I think.
Yes, the sense of freedom of not being tied to tobacco is wonderful. I don't have to worry, did I leave my cigarettes somewhere? Are they in my pocket or are they in my purse? That's gone. I don't have to go, oh my gosh, it's 11 o'clock at night, I need a cigarette and I'm out. I don't have to worry about that anymore. It's gone.